Dr. Vijay Surase, a senior consultant and interventional cardiologist at Jupiter Hospital, Thane, is trained in all forms of coronary interventions, peripheral interventions, and pacemakers. He has been actively involved in more than 10,000 cardiac catheterizations and holds the record for performing 36 angiographies in a single day. His reputation as the safest interventional cardiologist has earned him an appointment as the honorary consultant cardiologist to the Governor of Maharashtra, Mantralaya, and the Maharashtra Police. For his relentless work in the field of cardiology, he was awarded the prestigious Anmol Ratna Award. A philanthropist at heart, he has voluntarily conducted more than 170 free medical checkup camps across India. He aims to educate and bring awareness to the masses, especially people from the economically backward sections and the Adivasis. Thank you for joining us, Doctor.
Thank you, Dr. Reshma.
Doctor, in your practice, what are the kind of trends that you see these days? I mean, are there younger patients coming into you? What about men versus women? What are the kind of trends that you see?
Yes, truly said. Now, what we are seeing is, in our practice, a lot of young population is approaching towards us. Means not only to the cardiologist, but all the specialties. A lot of young females also. Previously, those who were declared as naive, means who were declared as immune to particular disorders in the cardiac sector, they are also approaching towards us.
And what do you think might be the reasons for the same?
Actually, doctor, it is a lifestyle change, and in a sense, the overall life expectancy has also increased. So we see both our broad population coming in towards us, young population also coming towards us, and also the oldies coming towards us for the medical treatment.
But maybe the percentage of the younger lot is increasing.
It is not that. But if you actually study the population mass, the diagnostic modalities which are available at the stone throw distance towards the residential places, the diagnostic tools which are available, the amenities make the diagnosis easier for the population to get diagnosed of the disease and treated as well. And same is true, as I said, when the life expectancy has increased. Earlier, if you study in 1950s and 60s, the life expectancy was 41 years. Then later in 1960s and 70s, it came up to 55 years of age. Over a period of last 3 decades, we have seen that people are living up to age of 75, 80 years safely without any medical problem. So people getting diagnosed with this medical disorders, then disorders related or pertinent to the heart, disorders related to other specialties like malignancies are also, they are on to accountable rise in the number.
So mostly it's a combination of awareness, better awareness,
True.
as well as better diagnosis maybe.
Very true, very true.
That we are seeing these trends, right?
But I got your point. You are stressing on younger population. I too see in my clinical practice, and most of my colleagues will also agree, a lot of younger generation is developing hypertension. They are getting diagnosed with first time hypertension. They are coming with diabetes mellitus as first diagnosis. Most of them we see they are obese. Now see, diabetes, hypertension, obesity, then other issues like lifestyle related, those which put them into socially bad habits like alcoholism, the excessive use of tobacco, smoking, it puts them at excessive risk of development of the heart disorders. Like we are not surprised to see even patients in the age group of 30s developing heart attack. When we see earlier, when we studied the population, those kind of patients which were seen into their 30s and getting diagnosed with a heart attack were totally rarity. But nowadays we are seeing almost 8 to 10% of the population below 40 years of age group getting diagnosed as heart trouble. Maybe it is coronary artery disease, maybe it is hypertension, maybe it is medically insignificant disease as on today, but it is definitely going to cause a toll on the general population. And this is a productive age. If a person who is into 30s and 40s gets affected with a heart problem, it's a lifetime problem. Person is going to live with this problem, and the family is going to get affected, the productivity is going to get affected, and ultimately nation is going to get affected.